Hi, I'm Katelynn, and today we're going to be talking about personal protective equipment. You're going to want a gown, tied up here, and then your thyroid collar, your dosimetry badge, probably on the outside there, and the gloves. And this is all to protect you from scattered radiation.
Hi, I'm Phil. Today we're going to practice, and I'm going to show you animal safety. Today we have a cat. Often we use for restraint we use a cat muzzle. And sometimes we use chemical restraint, which is not normally used during an X-ray operation. We also use tethers, so that way we can place this on the extremity to avoid putting your hands in the primary beam for your safety. And during an OFA operation, the animal will be sedate during the operation because the operation puts quite a little stress on an animal like this. And basically for your safety, muzzles, leashes, and tethers are primary sources of restraint.
Okay, this is Taco. He's going to be our little patient today. We're going to be measuring for the abdomen, VD, DV, and right lateral, left lateral. So you want to get the measure, and for VD, DV, you're going to be measuring at the 13th rib, because that's the thickest part of the abdomen. And his measurement would be 9 centimeters. And then for lateral, right lateral and left lateral, you could measure the other way, same at the 13th rib, and he would be 9 centimeters this way also. And then you go up here and you choose abdomen, and then choose 1 through 10 centimeters since he was 9. Go up to 9 centimeters, and this is going to automatically set the KVP and MA for you.
We're going to demonstrate on how to position for a right lateral radiograph. Normally you'd have your protective gear on, but we're just demonstrating positioning right now. Since your settings are already correct, we will just position her in right lateral. And you're going to want to have the light at the 13th rib and the head of the femur. So we can collimate.
Hi, I'm Sam, and I'm going to show you how to set up the X-ray machine. To turn it on, you flip this switch here to on, and then hit this button here, and it'll take a minute for the machine to warm up, I guess. And then, when it's ready, press and select the side of the animal that you're going to be working on. And then select the abdomen, because that's what we'll be taking a radiograph of. And then from your measurements earlier, select the category that your measurement fits into. And then use these buttons here to select the actual size of your measurement. And then here is the light and the collimator for when you actually have the animal on the table.
Hi, I'm Katelynn. I'm going to show you how to set up the automatic developer. A good thing to follow is this sheet right here. So we're first going to make sure this is closed, and then you're going to push this button on the side, and then that's going to say run, and then you're going to push that, and then it'll be getting ready, and it takes about 20 minutes to do, so make sure you do this before class.
Hi, I'm Abby, and I'm going to show you how to set up the CR machine. First, you want to put the patient ID or name. I'm going to choose my dog, Scout. Responsible party would be myself. Species, Scout's a canine. Date of birth.
Could you not?
She is a female, and she is spayed, so I will choose altered. Okay, next we're going to choose what views. We're going to be doing abdomen, so you click on abdomen. For canine, we're going to do VD and DV, so you click that twice. And then we want to do right lateral and left lateral, so click this twice. And then start study.
Go.
Now that we have the measurements and all set for abdomen, we get the animal into position. This is left lateral, and the landmarks for the abdomen is the xiphoid process and the head of the femurs. And then when we are all set, we want to take the radiograph on maximal inspiration so that we get the radiograph taken on maximal expiration.
And go.
Alright, this is right lateral positioning for the abdomen, and the measurements are the same. Marks for the abdomen is the 13th rib and the head of the femurs. And for the abdomen, you want to take the radiograph on maximum inspiration so you get it on maximum expiration. This is positioning for DV, and we changed the measurements to 11 centimeters because that's what we measured. And this is what DV is. Okay, the measurements for VD are the same as DV, 11 centimeters. And this is what VD looks like. And you can use this tray to get them in position and get them straight. This is the DV view of the abdomen. This is the VD view of the abdomen. This is the right lateral view of the abdomen. This is the left lateral view of the abdomen. We obviously missed the femoral heads, and we probably were up a little too far up.
My name's Phil.
Everybody I know that went had a radiograph film. One guy was out for 20 minutes on the first morning and popped at 8 by 9.
The dark room where the processing takes place.
Yeah. Like seriously.
We call this the dark room.
Get the splits
I want to
together.
avoid exposing the film to the natural light. We're exposed to film the natural light.
You've got an open spot now.
The film will turn black. This is why we cannot expose the film to natural light. The door must be shut, closed, and the lights off. These are safety lights, which are allowed used for light to see the process.
Something like, I'm going out with Brian.
Take a
And
film.
or something like that. She's like, and now I'm loco crazy.
Oh, right there. You went out with Ryan.
Now I'm loco.
And now I'm
Open the door to the process.
She's like, rah.
Once the film is set.
Hey, go.
The machine will kick off, you grab the film, you start to take it, close the door, now you leave the dark room.